First visit to the gynecologist. A woman's healthcare is very important throughout all stages of her life. Scheduling her annual gynecological checkup is an essential part of this process. After all, it is easier to fight a potential problem in the early stages rather than wait until the problem fully develops into something more serious. First visit to her gynecologist is the most crucial step in the right direction. Some women may feel nervous about their first visit. That is why we would like to give you some more information about it. What should I expect at the first gynecological visit? The first visit may be just a talk between you and your doctor. You can find out what to expect at future visits and get information about how to stay healthy. You also may have certain exams. When? Schedule your first visit just after the end of your menstrual bleeding. Prepare yourself. Avoid sexual intercourse and the use of tampons or vaginal creams 2 days before your visit. Dress in comfortable, easy-to-remove clothing. Write down any questions you may have before your visit. What happens during my visit? Before the examination, it is important for your doctor to know your medical history. For this reason, we would kindly ask you to fill out a patient's history questionnaire. We would like to ensure you that our doctors as well as our personnel are obliged to complete confidentiality of any medical or personal information. Therefore, you should not avoid giving any information that may be important for the diagnosis and your treatment. For example, smoking, previous unwanted pregnancies, use of illegal drugs or substances. Please let us know if you have never had sexual intercourse. Then your gynecologist will welcome you, ask you some questions about your past medical history and your current problems. After that is the time for the clinical examination. We are aware that the gynecological examination may make you feel uncomfortable. That is why in our center, the examination is always done in the presence of a midwife or a female nurse, which will also help you get ready. She will guide you in the changing room, give you a cover sheet to put over your legs, and help you get the appropriate position in the examination chair. When you are ready, the doctor will enter the examination room and start with the pelvic exam. This begins with the inspection of external genital organs. Then the doctor will use a speculum to look at your vagina and cervix. If required, a sample of cells will be collected from your cervix with a small and soft brush. This is a smear for the Pap test. To check your internal organs, the doctor will place 2 gloved fingers into the vagina and with the other hand will press on your abdomen from the outside. The whole process takes a few minutes and is carried out with gentle handling and use of lubricant to avoid any discomfort. The examination is completed with a transvaginal ultrasound scan and the breast palpitation. If you have any remaining questions regarding this process, feel free to contact our center where you will be greeted by one of our personnel whom will be more than happy to help.